The infectious disease HIV and AIDS and the impact they have on homosexual Latino men in San Francisco, California, Part 2 by Danielle Curtis, Nicole Raycock, and Roger Connor. Assurance. Some of the laws and regulations that have been established to assist the Latino gay men within the San Francisco community is the Affordable Care Act. Since its activation in 2014, the law has allowed the Office of AIDS, the California Department of Public Health, and other contractors the ability under the HIPAA law and specified conditions to share HIV-related data. This law aids in the potential ability to connect and make patients aware of healthcare reform and healthcare plan options that they can afford and are eligible for. On January 1, 2012, Governor Emmett Brown signed into law governing bills that would assist in the combat against the spread and contraction of HIV and AIDS through prevention and surveillance. These new laws now enable the sale of syringes without prescription, authorization for implementation of syringe exchange programs, the ability for test counselors to perform other tests for detection of other associated diseases, permits the notification of an HIV patient and their contact information to local health department services. There has also been changes to the reporting process to improve the accuracy in reporting and the compliance of guidelines set forth by the Center for Disease Control and Prevention of HIV/AIDS guidelines. The San Francisco AIDS Foundation has played a leading role in the development of HIV/AIDS policies and resources at the federal, state, and local levels. These policies and resources has aided to ensure that there is an ongoing, evolving approach and effort in the combat against HIV and AIDS epidemic. The San Francisco AIDS Foundation has aided to protect human rights of individuals who are living with HIV and AIDS by promoting development and creation of effective HIV treatment and prevention strategies. Due to the intertwined correlation between HIV and AIDS prevalence in the socioeconomic suppressed communities of the Latino population, programs such as the Low Income Health Program was established by the California Department of Healthcare Services to aid them with compliance with laws set forth in the Affordable Care Act, healthcare reform. This program helps to expand primary coverage to those who are uninsured due to low income. Some may also be eligible for drug assistance services. Title VI of the Federal Civil Rights Act of 1964 mandates bilingual services for those who have a limited proficiency in the English language. Under the law, the California Department of Health ensures that it will have available resources and personnel to assist those with language barriers, such as those in the Latino communities, that have adequate access to care and resource available to them. The City of San Francisco, with the assistance from federal, state, and local programs, have made great strides in combating the prevalence of HIV and AIDS within the Latino communities. Due to the implementation of programs such as the Ryan White program and the Low Income program, more individuals are now able to afford and take advantage of programs that provide them with effective assistance. HIV-positive Latinos who are eligible citizens that fall 133% below the nation's poverty level may be eligible for healthcare coverage under the Medicaid program. The Ryan White program has provided over $2 billion for people living with HIV and AIDS. The Housing Opportunities for People with AIDS program provides $300 million annually for housing. The California AIDS and Drug Assistance Program provides access to care for about 36,000 people who could not afford their medication. The Minority HIV and AIDS Initiative provides $400 million for programs that are geared to assist those within the racial and ethnic minority communities. Since its discovery, HIV and AIDS has had an increasingly negative impact on the lives of gay Latino men within the San Francisco community. The amount of existing and new cases are alarming to the point where it is considered an epidemic. Due to this horrific fact, healthcare professionals, consumers, and governing officials have all come together to give their best efforts in the combat against this disease. Together, they have been able to have success ensuring that people within the Latino community have access to care, means for paying for care, resources that they can understand, all while enhancing and protecting the rights of the consumer. The 10 essential services of public health has helped address the HIV and AIDS issue within the Latino communities of San Francisco by assisting to access and identify the health problem HIV and AIDS within its communities of gay Latino men, diagnose and investigate causes of AIDS within their communities, inform and educate the public about available resources and options, coordinate and mobilize community partnerships, develop policies and plans that are effective for the minority population, enforce law and regulations that help protect the health information of consumers, connect the Latino communities to resources they can understand, increase and assure evolving competence of the healthcare workforce, review and evaluate performance of services for effectiveness and efficiency, while continuing to research new innovations for solutions to the communities of those affected. This concludes part 2 of our presentation on the infectious disease HIV and AIDS and the impact they have on homosexual Latino men in San Francisco, California. Thank you for watching.